The Vice President of the United States, Mike Pence, met the chief executive of the 3M company today. Now, the company is the manufacturer of N95 masks. They are in short supply in some places. Mr. Pence thanked the company for its actions in response to the virus outbreak.
Decisions were made here at 3M, literally at the outset of the coronavirus. 3M made the decision literally to go to full capacity here in the United States in the production of the respiratory masks, the N95 masks that you create with such professionalism.
Now, the shortage has been widely reported. In some cases now, the authorities are asking people not to buy masks because they should be reserved or left for healthcare workers and those in the industry. Clare Sebastian visited a medical distribution facility to see the crisis firsthand and sent this dispatch.
So these are all our face masks. We store them in a secure room.
For medical supply company DealMed, this is part of a new reality at their New Jersey distribution center. They have also added armed security outside.
There's people that keep coming in from the street, knocking on the door, trying to take product.
Masks are the biggest concern here as demand spikes because of fears over the spread of the novel coronavirus and supplies run short. DealMed, like many others in this industry, sources its masks from China.
The only production that we're told that's happening right now is the production in China, which is staying domestic for the Chinese government.
So you're going to run out?
We're absolutely going to run out, but we have contingency plans in place. We're trying to do the best we can for our customers.
DealMed can no longer sell based on demand alone. Every day they hold a meeting to make potentially life-changing decisions about who should get their limited stock.
So it's going to the actual hospital. What do you want to do, Chuck? Let's do 10 today. We'll talk tomorrow again. We'll put them on the list for tomorrow.
10 boxes is just 200 masks. DealMed tells us that the hospital had requested 6 times that. Supply issues are mounting. China, the world's biggest manufacturer of medical face masks, says it's not imposing any export restrictions, but several Western companies tell us they have not been receiving orders. Countries from Germany to Thailand have banned exports, and the French authorities announced this week they are taking control of all medical masks to distribute to health professionals. Medicom, a Canadian manufacturer of masks and other medical supplies, says as of late January, their 3 Chinese factories are prioritizing local demand. They're not yet sure what will happen to their factory in France, and here in Augusta, Georgia, they are ramping up as fast as possible.
We were basically doubling the capacity of the factory over a period of 4 to 6 months between additional shifts, additional equipment. But additional equipment takes a lot of time. These are custom-made machines.
They're also not taking on new customers.
We decided from day one to go on allocation, to only distribute to existing customers the historical demand, to avoid any speculation, stockpiling, additional safety stock, which is a big disruption.
So you have wipes, gloves as an example.
Yeah.
These are other products that are increasing in terms of demand.
At DealMed, staff are also working extra hours. 3 new team members have been hired, and they're starting to feel the pressure.
This is a terrible situation right now, what's going on right now. I mean, it's terrifying. I mean, we have healthcare workers that are going to run out of face masks. That's a terrifying situation to be in. But we feel that it's our obligation and our responsibility to the industry to work with our customers and be the calming voice during these crazy, crazy times.
A calming voice in the face of unprecedented demand and dwindling supplies.
So, Clare Sebastian is with me, as you can see. And so, I saw earlier, some people are saying, don't buy masks.
Right.
President Obama, I think the former President Obama was saying, don't go out and rush buy masks.
And we heard the same from Mike Pence today at the 3M factory. They're telling, the CDC and other US authorities are telling people, if you're not sick, don't go and buy a mask. And I think part of that is to try to control the panic buying that we're seeing that is sort of exacerbating the emergency that this industry is already in, Richard. There are very few people in the United States who actually make these masks. Bear in mind also that...
Do they work?
I mean...
N95 is different to those sort of surgical masks that we see sort of people using.
I'm not a doctor. I'm not qualified to tell you whether it will work or not. But I think, certainly in China, they're encouraging people in some regions. In some regions, it's mandatory. I think that's partly cultural. You would see people wearing them some of the time anyway. But look, I think perhaps they do block out some of the pathogens. The N95s are supposed to block out 95% of particles. But the bottom line, Richard, is that this industry is facing unprecedented challenges. And we now have a situation internationally of sort of medical supply protectionism. France is requisitioning supplies. Germany has banned exports, the same in Taiwan, Thailand, all around the world. People are trying to protect their domestic supplies. The good news is that it's probably temporary.
But also, it's very difficult to suddenly... I mean, an existing facility can be ramped up within certain parameters, but you can't suddenly build a factory that's going to produce these masks in the short time of this crisis.
It takes a long time. You heard the COO of Medicom, the Canadian company, saying there that they have very specialized equipment. These are custom-made machines. They have to be very careful as well how they ramp up, because other companies have been burned, they told me, during things like H1N1, when they ramped up and then didn't have anything to supply to at the end of it.
Claire, I just want to talk about the market. We're seeing it down. We're down 1,000 points, nearly 3.75%. Those stocks that we've kept looking at just are absolutely creamed.
I mean, it's hard to know what to say anymore, Richard. The volatility is really something that you've only seen during the financial crisis. And we're seeing some of the top losers today, the likes of Boeing, which is, you know, one of the highest weighted on the Dow. That's clearly dragging down the rest of the index, and the banks as well.
Thank you. Clare Sebastian.